The advantage of ankle arthroscopy is, compared to the traditional open surgeries, we make a long cut, dissect the joint, open the joint. That would risk the stiffness of the joint post-surgery. Hi, I am Dr. Veerendra Mudnoor, consulting orthopedic surgeon at Apollo Spectra Hospital, Hyderabad. I am specialized in arthroscopy and joint replacement surgeries of the hip, knee and the shoulder. In this video, we will talk about role of arthroscopy in ankle. Ankle arthroscopy is a procedure where we put a small telescope into our ankle joint and view the whole of the ankle joint on a television monitor, which is connected through a camera to the television monitor. Loose bodies in their ankle. If they are suffering with an ankle arthritis, it could be septic arthritis or rheumatoid arthritis, where we need to debride the joint and take sample for biopsy. These patients would be requiring ankle arthroscopy. It is also useful in patients who have got an anterior ankle impingement or a posterior ankle impingement. It is a condition where the impingement is secondary to kissing of the bones, the talus and the anterior aspect of the tibia. That would lead to a bony outgrowth called as a spur. This spur would be excised through an arthroscopic procedure with the help of arthroscopic shaver, burr and a radiofrequency ablator. Ankle arthroscopy is also used to treat sports injuries like anterior talofibular ligament injuries. The advantage of ankle arthroscopy is, compared to the traditional open surgeries, we make a long cut, dissect the joint, open the joint. That would risk the stiffness of the joint post-surgery. In ankle arthroscopy, we make a simple stab incision and do whole procedure through that stab incision with the help of an arthroscope. Recovery of ankle arthroscopy, the patient is advised to non-weight bearing initially for about 2 to 4 weeks with the help of a walker. He is advised physiotherapy, where passive mobilization of the ankle joint is done, followed by strengthening exercises for the ankle joint. It is very important that you do weight bearing after about 3 to 4 weeks as tolerated and do a very good strengthening for optimal results. Risks of ankle arthroscopy are very minimal. The risk of infection is, compared to any open procedure, is very minimal because we are not cutting any skin and muscle. So risk of infection is also very less. Risk of injury to other structure is also very minimal. And the risk of stiffness, which is very common in open surgeries, is minimized in ankle arthroscopy. If you are facing pain and stiffness of the ankle joint, or if you are suffering from an ankle ligament injury, which is an anterior talofibular ligament injury, at Apollo Spectra Hospitals, we are here to help you.